Hi, my name is Mariah, and the health topic that I'm going to be presenting on today is diabetes. So, right here is just my table of contents. I'm going to be discussing what diabetes is, what domains of health it affects, and how can we as teachers support students who may have diabetes in our classroom. So, before we get started, I have a QR code for you guys to scan, just talking about the misconceptions surrounding diabetes. And I'm just going to ask you to select the misconceptions that you believe to be true. And I'm going to have another QR code at the end of this presentation, just so you can reflect on your learning throughout the presentation. Okay, so there are two types of diabetes, type 1 and type 2. Type 1 is when the pancreas produces little or no insulin. So, in a person who doesn't have diabetes, the insulin binds to receptors on the surface of a cell and signals transporters in the cell to transport glucose, which is the sugar in our bodies, to different places. However, with type 1 diabetes, since there is little to no insulin, there's no like signal to instruct the cell to transport the glucose. So that glucose then starts to build up inside of the bloodstream, which means that you will end up having too much sugar in your bloodstream. And with type 2 diabetes, the pancreas still is not producing enough insulin, but there are also some cases where the body is resistant to insulin. So some of the insulin binds to receptors on the cell surface, but the signal is still being blocked. It's not able to transport that glucose, and that's what causes it to build up in the bloodstream with type 2 diabetes. So students with diabetes must take insulin shots or wear like an insulin pump every day to manage or regulate their blood sugar levels and give the body their energy that they need. There's also instances where the blood sugar levels may like drastically drop, especially for people who have type 1 diabetes. And so they'll have to eat some sort of carbohydrate to raise those sugar levels. Some symptoms of diabetes include frequent urination, extreme fatigue, blurred vision, frequent infections, and tingling or numbness in the hands and hands and feet, and also dry and itchy skin is a symptom of that. So, because these students have so many of these symptoms, it affects several different domains of health, including intellectual, because students might be too tired to like engage in a lesson, which means that they're missing out on critical learning time. It affects their emotional health because they might be uncomfortable due to their fatigue or itchiness of the skin. Students might be, they also might feel embarrassed because they might feel different from other people of their age. It affects vocational health because students might be absent from class due to medical emergencies or doctor's appointments. And it affects physical health for sure because they're more susceptible to issues such as heart disease or nerve damage. So, what are some measures or practices that we can implement to support students in our class that have diabetes? Well, we can work with parents and medical professionals to understand the specific needs of the child. We can also even do like small things such as permitting or even providing those students with snacks or juice in the class, since some diabetic students are prone to low blood sugar. We can try to understand the symptoms or research the symptoms of when a student has low blood sugar, so that we're able to respond quickly. We should also be providing a supportive environment for them and, accommodating their academic needs by offering more flexible deadlines for assignments. We should also have like an emergency plan with emergency contacts and knowing like where supplies are stored to help with those students, in case of an emergency. And here is a QR code that I mentioned at the beginning of the presentation. Just asking you to reflect on what you've learned throughout this presentation. And yeah, that's all. Hope you enjoyed my short mini presentation, and thank you for listening. This is just my reference page. I feel like I gotta mention that. Thank you again for listening.